Joined on the line by a psychoanalyst specialising in trauma and director of London's Clinic for Dissociative Studies, Valerie Sinason. Hi, Valerie, and welcome to Drive Time.
Hello.
Hello, Valerie. I thought you weren't there for a second.
Oh, right.
Now, you actually, first of all, can you just tell us about the Clinic for Dissociative Studies?
Yes, it was founded 13 years ago. I was a child psychotherapist at the Tavistock Clinic, which is one of the biggest health service training and treatment centres for outpatient psychotherapy. And I was mainly working with children with a learning disability who'd gone through horrendous amounts of abuse as a vulnerable group that find it hard to communicate or be believed. And while doing that work, I was asked to supervise a case in Sweden, which was a woman who had been even more sadistically treated by her staff members. And it was through doing that work that we started a pilot study looking at people making allegations of extreme trauma, such awful accounts of multiple moments of trauma at the hands of many people, that the response was one of disbelief rather than greater sympathy and protection. And I decided to start a new clinic to help those because it seemed very strange that a group of children and adults who were already vulnerable, the more they suffered, somehow the less they were believed. So it's not surprising that in that first group I worked with over 20 years ago, I had 2 accounts of Jimmy Savile being an abuser, where I did support 2 people to go to the police, but it was seen as something impossible to consider at that time.
Seen by whom?
Seen by the police as real, but also by the wider community. We have improved a lot as a society in the last 20 years in accepting the reality of abuse, even though it's still so hard for us.
Now, Valerie, when someone has experienced this kind of abuse, where do they normally go to talk about it, and does it take them a few bounces before they find someone that will believe them, like you?
When we look at adults who were abused in childhood, we find that nearly all of them had told somebody. And often it could have been a fellow pupil at school, a teacher, a helpline, a neighbour. But depending on how that first person reacted, the victim can often shut up for another 10 years. Just even a kind of well-meaning teacher saying, "Oh, I'm sure your mum is a really nice woman, and maybe you got it wrong in your mind. I don't think she'd do something like that." Just somebody well-meaningly speaking like that can make a child then unable to speak and go through another 10 years of abuse. And similarly, going to a police officer, again, it's changed now. The culture of the police has changed dramatically, but 20 years ago, when even counsellors and social workers didn't think abuse could be so widespread, the police were obviously part of that culture too. I mean, it's hard to realise that in the 1980s, there was a point where it was thought there were only 486 children on the abuse register. Now, the government accepts that 1 in 4 adults will have been abused at some point in their lives. That is a huge change.
Now, Valerie, how was it that did you yourself speak to the police at the time of speaking to Savile's victims, or did you said you helped them to go, but what's that process? And if the police don't listen, can you actually sort of weigh in and say, hang on, you really should listen to these people? Is there anything you can do personally?
I think it's much easier to be a forceful advocate now than it was in that period 20 years ago, that where somebody said no and you said, but I want this taken up at a higher level, you could be told, I'm sorry, this person is a vulnerable victim. I don't think the Crown Prosecution Service will back this going any further. They're likely to break down in court. We don't think this has got a chance of going anywhere, and we are not sure that it's true. This is really different for any survivors listening now. If a police officer doesn't listen sympathetically and offer a believing response, then something has gone wrong, because the police really do have this in their guidelines now.
Okay, going back to these victims, what did they tell you about what Savile had actually done?
Well, what will be really awful for people listening, outside of those that may have read it in a couple of the newspapers that reported it, was that Savile was not only abusing all children with and without disabilities in group settings, in individual settings, in hospital settings, he was also invoking belief systems, doing rituals, making children believe he had extra powers, and that if they didn't obey him, they'd also be punished in an afterlife.
Well, in what way? How could he do that? I mean, surely, I know that there's been this headline about your work talking about satanic rituals, but, I mean, does that actually bear any relevance to any kind of real religion, or did you think it was just done to scare the children?
That's a really important differentiation. First of all, can I make clear that there are Satanists that would never harm anybody. It's a legal belief system. And I've met many Satanists who became Satanists because their churches were threatening them with the most horrendous punishments in an afterlife for having done wrong things, and they became Satanists in order to feel they could die safely and wouldn't be tortured in an afterlife. So please let me say that first of all, that when I talk about Satanist abuse, I am in no way saying all Satanists are abusers, any more than when we speak about abuse by Catholic priests, we're saying all priests. So, but where Satanists are abusers too, then there are extra things in, especially, for example, Aleister Crowley, that can be used to frighten children more. But the use of cloaks, of making spells, of making threats, of threatening what will happen after death too, is something that the 5 different people that have spoken to me about Jimmy Savile all said he'd been part of.
Now, there was a piece in Private Eye about you, Valerie, on the 22nd of February to 2nd of March this year edition, after the headline in the Daily Express, really questioning whether there was any kind of corroboration for this, and effectively insinuating that you had been making this up.
When there is abuse by itself, it's scary enough. When there is abuse within a religious setting, it is so terrifying to people. Look how long it's taken. The Ryan report of 2009 took till then to talk about ritualistic kinds of abuse children in Ireland went through at the hands of nuns and priests. So nobody can bear it when it's linked to religion. But when it's linked to a religion that's not mainstream, it seems to frighten people more. As if, yes, abuse exists, Satanism exists, but you couldn't have Satanist abuse. And in fact, at one point I said maybe the whole country should convert to Satanism, because it seems as if Jews, Muslims, Buddhists, Christians abuse their children, and Satanists are the only people that don't. So it's not surprising that people find these serious allegations really frightening. Now, I'm not a police officer. I'm a psychoanalyst and a therapist, and what people say in the consulting room is private, but as somebody that's been there at the forefront of getting disclosures from children and adults with a disability for 30 years, where people have asked me to go to the police or speak about something publicly, I have done this with their permission. So no, I haven't been in a ceremony, but I've seen the marks on them, and I've seen the terror they're in, and I've seen how they were before such events happened, and how they are when they speak about it, how consistent they are in other things they say, so that there has been no reason from a psychological point of view to doubt their capacity to give good evidence. But it's the police that need to find the proper corroboration